When is the right time to start or adjust medication when you have Parkinson's disease? This is our topic today. First, I must tell you that every patient responds to medication differently, including side effects, and there's no way to predict that. Now, if you ask me when is the right time to start medication, that depends on many factors. But I will give you two main reasons for you to start medication. Reason number one is when the symptoms start affecting your daily activity, your function, it's time to start medication. When you cannot playing the piano, so you are a person who always you are always able to play the piano and you cannot do it, that's a reason to start medication. When you have pain, discomfort, because you have too much stiffness, and this is affecting your function, your daily activity, things that you do every day, that's the time. This is the time to start medication. Also, when you have tremors, and the tremors are affecting your function, making you feel embarrassed, that's another reason to start medication. Remember, not every patient with the diagnosis of Parkinson's disease will have tremors. 25% of the patient, 20% of the patient, they don't have tremors and they still have the diagnosis of Parkinson's disease. And remember also that mm, frequently, many patients with the diagnosis of Parkinson's disease and with tremors, the medication don't even touch the tremor, okay? And you still have the diagnosis of Parkinson's disease. Another reason to start medication when you have the diagnosis of Parkinson's disease is when you think that taking the medication will increase the probability of you doing exercises, of you increasing the frequency or intensity of the exercises. That's another reason to start medication. Because remember, exercises is one of the most important treatment in the setting of Parkinson's disease. Now, let's say that you are taking medication for Parkinson. Then when you should adjust your medication. So I will give you a few reasons for that. Reason number one is when you are wearing off. And you might ask, what do I mean with wearing off? Wearing off means that the medication is out of your brain, out of your system. So you are having, again, Parkinson symptoms, slow movement, the stiffness, the resting tremor. This is wearing off. So that's a reason to adjust medication. Another reason is because you are moving too much. You are having what we call in movement disorder dyskinesias. Dyskinesia typically is a peak dose. The majority of the time it's a peak dose, not always. So you take the medication, for example, the carbidopa levodopa, after having the disease for 4 years, 5 years, and then 1 hour later, you start moving your head like this. Okay, so that's the most common one. But also you might have a little bit of abnormal posture. We call that dystonia. This is another type of dyskinesia. Okay, but the most common one is what we call chorea or dancing-like movement. So if it's mild, not affecting you, you don't have to do anything about it. But if it's severe, affecting your walking, your function, then yes, you need to adjust medications. If you like this video, don't forget to subscribe to my channel. See you soon.